Hi, my name is Rachel, and I am a family nurse practitioner student at Texas A&M for a few more weeks. So I am here today just to tell you about what it is to be a family nurse practitioner, how do you become one, kind of what the job entails. So a family nurse practitioner is a registered nurse who goes on to get a little bit more education to where they can work in a doctor's office, a hospital, to assess, diagnose, and treat patients. So one of the biggest differences between the registered nurse and an advanced practice registered nurse, which is what a family nurse practitioner is with that degree, a nurse, definitely assesses. They definitely have ideas on diagnosis, but they cannot officially diagnose a patient, whereas an advanced practice registered nurse can. So again, this kind of leads to more education, which is usually between 2 to 4 years. You can get your master's degree or your doctorate degree through school. This typically involves maybe 500 plus clinical hours, the didactic courses, so kind of adding on to that education that you received as a registered nurse, as advanced pharmacology, learning about the drugs, advanced pathophysiology, how the body works. So it's just a little bit extra schooling, but it allows you to diagnose and actually treat the patient with or without medications. So once you get done with school, you'll have your family nurse practitioner. You can also get an acute nurse practitioner. There's also women's health, pediatric, you can specialize. But once you get done with that, you go on to your licensure, which involves taking the boards. There's two different types. You take that, hopefully pass. You'll get your APRN license. So it will be a family nurse practitioner / APRN. Once you are done with licensure, you go through the certification process, which just involves like verifying education, verifying the license, verifying your RN license is good, looking at certification, just a little bit, making sure all our I's and T's are dotted and crossed. Once you are done with that process, you are beginning to work as a healthcare professional that diagnoses patients. So you're working with medical doctors and PAs to treat patients. So the difference between like a family nurse practitioner and a medical doctor is a medical doctor goes and they get the 4 years of school, and then they do 4 more years of school to get the MD behind their name. Whereas a family nurse practitioner usually gets their RN license, works a little bit, and then goes back. Because a medical doctor does do a little bit more extensive education, they are able to do a little bit more diagnosing, and then also like treatment wise, which can be like stronger medications, whereas family nurse practitioners have a little bit of tighter control on what kind of narcotics and stuff they can prescribe. PAs are kind of similar to doctors and then kind of similar to family nurse practitioners. They receive their 4 years bachelor education, and then typically they go right into PA school, which is a 2-year program. So it's kind of similar to doctors in the way they just go straight to school. But they're similar to family nurse practitioners in that they have a little bit tighter control on what kind of narcotics and pain medicine they can prescribe like family nurse practitioners do. So that is kind of the big difference between those. Again, the nurse practitioner is the registered nurse who goes on and gets a little bit extra education to where they can diagnose and treat patients. But that's basically just what it takes, the schooling, getting the boards exam, and then once you get all that done, then you're actually diagnosing and treating patients with the doctors and PAs in various settings. But that's what it is. Thank you.